Hi everyone, my name is Lindsay Bastian and I am a junior studying environmental engineering and global health here at Arizona State University, and for the past 6 or 7 months I've been studying HIV. So tonight I will be talking about HIV with you all. So just so you guys all know, this will be a 5 to 7 minute presentation on HIV transmission. If you have any questions, please feel free to unmute yourself and interrupt me or put it in the chat. If you have to go to the bathroom, feel free to step away from your computer and join us when you can. So I just want to talk about the elephant in the room before we get started. HIV is hard to talk about, and talking about sexual health is uncomfortable at times. It's awkward. But tonight I'm going to try to make this conversation as painless as possible, and I want you all to know that this is a safe space and whatever you share will remain confidential, so this is a safe discussion for us all to have. So, HIV, there is no cure for HIV in the world, but it is 100% preventable. So we need to understand how HIV is transmitted and how it's not transmitted in order to protect ourselves and our loved ones. So there are five main fluids that HIV is present in, that it can invade your body and infect you. So does anybody want to guess what one of the 5 fluids is? Yep, blood, vaginal secretions, yeah. The next one, pre-ejaculate, yep, semen, and breast milk. So, like I said, we have vaginal secretions, semen, pre-ejaculate, blood, and breast milk. So we have our 5 fluids. Now, if one of these 5 fluids comes in contact with, like, my skin, I'm still not going to be infected with HIV. Even if I rub HIV positive blood all over my skin, I still won't be infected because the skin is a barrier. So in order for one of these 5 fluids to infect us, it needs to come in contact with one of these 4 doors. So, does anybody have an idea of what one of these 4 doors are? The mouth. The mouth is actually not a door. Does anybody have any other guesses? The vagina, yep. The tip of the penis, yep, you're correct. 2 more. The anus, yep. And the last one, does anyone know? The last one is actually an open wound. So, now that we have our 5 fluids and our 4 doors, we know that in order for HIV transmission to be possible, there needs to be both a fluid and a door present. So, now that we know our fluids and our doors, we can talk about how HIV is transmitted. So there are 3 modes of transmission with HIV. Does anybody have a guess as to what the first one is? Yep, the first one is actually unprotected sex. So if you think about it, about our 5 fluids and our 4 doors, what's present during sex? So our fluids, we have vaginal secretions, we have semen, we have pre-ejaculate, maybe even blood. And then our doors, we have the vagina, the tip of the penis, and the anus. So a lot of the body parts that are involved in sex are also involved in HIV transmission. So that is something to keep in mind. And I also like to point out that, so as we were saying earlier, pre-ejaculate is one of the fluids, and pre-ejaculate actually contains semen. So the pull-out method, if you've heard of that, isn't effective at HIV transmission prevention or pregnancy prevention or any other STI. So yeah, just a little aside. So our other 2 modes of transmission that we have are, the second one is, anyone want to guess? Blood to blood, yep. So, blood to blood, what do we have that are the fluids and the doors? Sorry. We have the blood, and then the door is the open wound. So that is the blood to blood transmission route. And then our last one, our third one, is actually mother to child. So if you guys remember, one of our 5 fluids was breast milk. So babies, they have like a bunch of sores in their mouths from teething. So when babies are breastfeeding, they the breast milk comes in contact with the baby's open wounds in their mouth, and they get infected with HIV. Also, during birth, HIV transmission can occur. What are the fluids that we have? Well, we have vaginal secretions and blood, and then our doors, we have open wounds from the baby. And then lastly, in the womb, which is very rare since the mother and the baby's blood supplies are separated. So now that we have our 5 fluids and our 4 doors, we can go through a scenario to see if HIV transmission is possible. So if I were to hug you, is there a risk of HIV transmission? Nope, no fluid involved at all. Okay, what about if someone were to give you a kiss? Nope. Saliva is not a fluid. So as long as we remember that there's 5 fluids and 4 doors and 3 modes of transmission, we can protect ourselves and our loved ones from HIV. Thank you. Thank you all for your time. I really appreciate it.